Hello. Today we're going to discuss the nervous system disorders, both acute and chronic neurologic conditions. In the neurologic conditions, the first thing you need to be studying would be what? Cerebrovascular accidents. And what is the common term for cerebrovascular accident? Stroke, right? So whenever you hear the word cerebrovascular accident, cerebro, what organ is involved?
Brain.
The brain. Vascular, what part of the brain is affected? Okay. Now you have to be more specific than blood vessels. Which one of the blood vessels? Cerebral arteries. We don't care about the veins here, right? Why the cerebral arteries? What do they bring in them? With them? Oxygenated blood. So don't mention about veins. They don't. Well, they're important, but when you're dealing with strokes, you have to hit the nail on its head, which means there's something wrong with the cerebral what? Arteries, right? You understand? Now, so there's really no accident here. It's a cerebrovascular accident. Some would use the word CVD, which means what? Cerebrovascular disease, right? So organ involved, brain. What part of the brain? The cerebral arteries. Now there are 3 types of strokes, the most common ones, right? First one would be what?
Ischemia.
Huh?
Ischemia.
Ischemic infarcts, which would be what? Okay, thrombotic. And the other one is what? Embolic. Right? Is it on?
Yes.
You want to be sure. Okay.
Yes.
I might be talking here for nothing, so I just want to be sure.
Yeah.
It's recording. Okay, good. So what's the difference between thrombotic and embolic? What is the difference between a thrombus and an embolus?
Ambulance is the cardiac.
Okay. Embolus is what?
Cardiac dysfunction.
So an embolus is a what? Give me the definition. I'm not asking where it came from. It's a traveling clot, exactly. Okay. Travel clot. What do you notice I placed in the whiteboard? Keywords. As people who are in the process of learning, you are expected to only retain information that is relevant. It is therefore important that you as a student must pick up those words that are golden words of wisdom, the golden nuggets, right? That's why when you read the book, there's so many words there, but you have to be able to what? Get a metal detector, oh, gold, oh shit, gold, and it is. Everything else you throw there where? In the trash can, right? So, a traveling clot. What about a thrombus? What's the difference between this and this?
Artery.
Stationary. I like those words. When you give me a right word, my heart is so happy, you know, because that you are learning, okay? It's the proper word that you need to give me and you need to learn. So what's a thrombus?
Stationary clot.
Okay, very good. Stationary clot. Okay? And that's a blood clot, of course, right? Okay? Stationary blood clot versus an embolic traveling clot. So if this is a thrombus, it means that if it's the brain, this, the cerebral artery has a clot that formed where? In the lumen. So it forms where? On the wall. Does it attach to the wall?
Yes.
Yes, that's why it's stationary. It's not moving at all. Right? Okay? Now, so that's very important. Now, aside from a clot that is formed here, what do you think will precede the clot formation? Okay, atherosclerosis. Similar to the one you have when you've developed an MI. So you have fat deposits first, develops, decreasing the lumen, leading to what? Ischemia. But eventually, in a thrombotic stroke, obviously the clot is formed there, in the wall. It's not moving, that's why it's called stationary. Is that clear? Okay? Now, embolic, on the other hand, what's the most common area where it comes from?
The heart.
The heart. Why the heart? That's why it's called cardio what? Embolic strokes. The source of the clot came from where? The heart. Can you tell me how did it get to the brain if it came from the heart? Which part of the heart?
Left.
Okay, which side?
Left side.
Left. Okay. Which one? Left atrium, left ventricle, or both?
Ventricle.
Okay, both actually. When you have atrial fibrillation, where is the problem? In the ventricle or the atrium? So both, everything that's on the left side. Why would it be the left side? Can you tell me why? Yes?
That's how pump directly.
How does it get to the brain? Does it go to the brain if it's on the right side of the heart?
No.
Why? Where does it go? Perfect. I'm so happy now. If you develop pulmonary embolism, the clot formed in the right side of the heart. If you have pulmonary embolism, the clot could be from the leg veins, right? Because it travels to the inferior vena cava, it goes to the right atrium, right ventricle. Why does it stop in the lung? The capillaries are small or very small. And what do you call those capillaries by there? There's a name for them. If they're in the lung. OMG. Don't you love anatomy? It's so simple, right? When you say pulmonary capillaries, where do you find the capillaries? In what organ? And how big is the capillary? 3 to 4 microns in size. Enough for the red blood cell to go through. Can you imagine the clot will get stuck where? In the lung, if the clot form in the leg veins and in the right atrium and the right ventricle. In other words, what I'm trying to say, the clot on the right side of the heart will never be able to reach what? The brain.
No.
Which is common sense. It gets filtered in the lung. Stops in the lung. On the other hand, if the clot is formed on the left side of the heart, guess what? The left ventricle is here. What major blood vessel arises from the left ventricle? Aorta. You have the ascending aorta, aortic arch, descending because it goes down, ascending because it goes up. What is the main? Is it the 170 freeway or the 10 north or 10 east or west freeway that brings it to the brain? Here you have what? Left common carotid. You have the left what? Subclavian, right? And the subclavian becomes what? Sub means below the clavicle. It becomes the axillary. Axillary becomes brachial. Brachial becomes radial and ulnar. Arteries carry oxygenated blood. They came from the aorta. This is on the left side. The left common carotid divides into two. Internal and then what? External carotid arteries. Are they the ones that bring especially the IC, giving rise to the cerebral arteries? So what do you call the arteries of the brain? Huh? Okay, remember? You have the middle, anterior, and then what? Cerebral what? Arteries. So every time you hear the word cerebral, it means arteries found in the brain. Anterior cerebral, middle cerebral, posterior cerebral, and you have the circle of Willis. On the right side, you have a brachio what? Brachiocephalic branch. Now what happens with the brachiocephalic branch? It divides into what? Right subclavian and divides into what? Right what? Common carotid artery, and the same thing happens. It divides into bifurcates. Bifurcate means divides into two. EC and then what? IC. You know what EC stands for? External carotid artery. While IC stands for what? Internal carotid artery. So same thing happens on the right side. It becomes what? The cerebral arteries. So what I'm trying to show therefore is that whatever happens to your patient, there will always be an anatomical scientific basis. If a clot is formed on the left side of the heart, it travels to the ascending aorta, to the arch of the aorta. It goes to, in the case of the left side of the brain, it passes to the left common carotid, the internal carotid, eventually ending up in the what? Cerebral arteries. Right? How does it get to the right side of the brain? The same thing will happen. Travels from the left side of the heart, goes to the brachiocephalic artery, eventually ends up in the common carotid, then eventually in the internal carotid artery, and then internal carotid eventually leads to what? The cerebral. Do you understand? The idea here, therefore, is that this is how you develop a cardioembolic stroke. And what does the clot do when it reaches here? It will block what? It blocks the flow of blood. And the moment there is no blood flow in the brain, what happens to the brain cells? Is that what we mean by the word brain infarct? Yes? So infarct is eventually from ischemia to infarction will occur. Do you understand? Okay? Now, the question here is this. Regarding here, it's very easy to, it's like in the coronary artery disease. If you have a lot of fat in your body, can they also deposit in the cerebral arteries? Okay, as time goes by, a clot can form, you end up in the thrombotic circuit. 60% of strokes is what? Thrombotic, based on statistical data. I'm just saying most of the strokes are 60% thrombotic, but it doesn't mean every time you see a patient you think of thrombotic stroke. Okay? Now, how did we form a clot in the left side of the heart, in the left atrium and the left ventricle? Yes? Left atrium and then what? How did you develop a clot there? How did you develop? So, in the blended learning program, you keep on telling yourself, I'm teaching myself, which is probably the best way to learn. Because you need to ask yourself, how, where, when, why did it develop? Without me there, of course, I'm here to guide you, but you are supposed to be reading and researching. Now, of course, there are things that you don't understand in the book, that's why I'm here. Can I help you? Hopefully, yes. Why? Because I practiced medicine for a couple of years. I saw patients, I know what to do with them, right?